Hello, everybody. My name's Lisa Jackson-Pulver. I'm a public health epidemiologist. I'm a Koori woman. I work at the University of Sydney. I'm part of OzSAGE. Today, we thought we'd bring together a number of experts, a number of people who wanted to share a bit of a story with you as we prepare for lots of travel and lots of time out and lots of time with family, friends and community members. We know at the moment that there are a number of things that are coming to the table this Christmas. One of them, of course, is the COVID, whether it's the Delta variant, the Omicron variant, or many conversations about it. So today we have a number of people joining us for a quick talk. The first is Michael Doyle from the University of Sydney. The second is Francis Nona from Torres Strait, who will be sharing with us a little bit of the story of what's happening in Torres Strait, as well as sharing some of the geography of Torres Strait. And we don't hear very much from that community and that area, and it's really important to pay attention to it today, so thank you. And Professor Melissa Haswell, who's Professor of Health and Wellbeing from the University of Sydney. So I hope you enjoy what we have to share. Please make sure that any of the resources that we mentioned, that you access them. I'll just say them up ahead here now. One of them is the OzSAGE.org website that this video is on. The second is, of course, your local Aboriginal and Torres Strait Islander community-controlled health organisations in your local area. And the third is your own health departments. So please rely on information on those websites. They are the ones that have got the science behind them. They're the ones that have got what the schedules are for vaccines. They're the ones that have the information that is most current and most important to you now. So let's listen to our first speaker. Over to you, Michael Doyle.
Thanks, Lisa. I think you've highlighted quite a few of the main concerns, and there is this sort of perfect storm that's happening or just on the horizon. And so we've had both highly infectious Delta and now even more infectious Omicron. And we've had easing of restrictions here in New South Wales and Victoria, and changes in Queensland and Tasmania and South Australia. And we're coming up to the holiday season, and so interstate travel, which is now possible. I know a lot of mob who are going to go from here in New South Wales, and they want to go see family in Queensland and vice versa, and down to Victoria. And so wherever we go, we take, if we have coronavirus, whichever strain it is, we can take that with us. And so while restrictions have been eased, we've really got to be careful, really careful at the moment about making sure we reduce the risk as much as possible, that we continue to wear masks. I still wear a mask in all enclosed spaces, all of that stuff, and I'm going to do that for a while. That's just what we need to do at this time. And we need to continue doing all of those things with social distancing and using hand sanitizer and all of that stuff that we've been doing. And I know people are getting a bit tired, but right now is probably crunch time. This is like the third quarter, if you like, of the game. And this is when things could really turn very, very badly. So if you are planning on going to see family, well, firstly, I'd say, can you delay it rather than going to see family right now? Can you put off until, say, February or March or something, and just hold off a bit longer? And so there's less sort of crowds, less sort of travelling. If you do get to a family event, there may be less people there, that sort of thing. So just reduce the risk. Every person less that goes to these, that travels and that attends all the family stuff that's about to happen, reduces the risk. It doesn't mean you're never going to see your family at all. But right now is probably the time to try and do what we can to care for our family by doing that. If we do go and have a family event, it's really important. It might be hard to think about wearing masks and that at a family event, fair enough. But can you hold it outside? Can you do things like that, which will also reduce the risk of that? And instead of having a huge event where everybody comes, you could have 2 or 3 smaller events, have different family at one event and then catch up with another lot of family at another one. And so there are things you can do that isn't necessarily going to stop the spread of COVID, but might reduce the risk and might reduce the chances of having sort of what they call a super spreader event. But the biggest thing really is making sure you get your immunisation. It works. And if you get immunised, if you've had your first dose, please, and you're due for your second dose, please go and get it. If you've had your second dose and you're now due for your third dose, please go and get it. It is the best thing you possibly can do at this point in time, is to go and get immunised, and to encourage family member who might be a little bit hesitant to get immunised as well. It won't necessarily stop you from going to hospital at all, but it'll really greatly reduce the risk of you going to hospital, and you won't get as sick if you were to get COVID. So they're like the main things, but we're in this really as a tricky spot right now. That's incredibly concerning. And like, we've had 2,000 odd cases in New South Wales to 8 p.m. last night, and it's kind of extraordinary, the risks that we're running right now. We've never had so many cases, and now we're about to have this travel where people go all over the countryside. So I think that's probably all I could say right now, is about just staying safe and keeping your family safe. And if you're young, yeah, sure, it might not hurt you, it might not kill you, but it will hurt your elders. And we can't afford to lose our elders. We really can't afford to lose any more of our old people. And so we have to keep them safe and making sure the young ones are kept safe. And with that as well, when it comes around to the 10th of January, please go ahead and get your children, your young children vaccinated as well, because it will protect them and it'll protect the whole community. That's, as I was saying, Lisa, thanks. And it's been working with you over the year. It's been a difficult challenge, working with this whole coronavirus. Thanks.
Yeah, thanks, Michael. Really important words. And I think there's a whole stack of key things that you've just shared. One of them is about the difficulty of making a decision as to whether or not go home. That's a big deal. But the other thing that is really important is how we protect others by ourselves being vaccinated, and by keeping true to the booster shots as required, because as we know, the kids can't get jabbed yet, and they're a very large part of our population. Okay, we're delighted that Francis Nona has come to join us. Now, Francis comes from the Torres Strait, and this is a large community, an important community that has got a lot to say about COVID, about resilience, and about what they need and what they see is going on. So please, Francis Nona from the University of Queensland, over to you.
Good. Hi to all and welcome. Firstly and foremost, I want to acknowledge and pay my respect to the people and the elders on the land I stand, to the Turrbal and Yagara people in Minjin, which is now known as Brisbane. So protecting our people at a time of disruption, as the border has been open between Queensland and other states, I thought I would put together some key messages for the people of the Torres Straits and the Northern Peninsula. So Torres Strait is a small region at the tip of Queensland. Right up the tip, we have Cape York, which is the mainland, and we have Papua New Guinea and the international border that runs through. And there's communities within Papua New Guinea that interact with Torres Strait Islanders up in that Northern Peninsula area with Boigu Island, Duwan and Saibai. The people of the Torres Strait are very unique in their culture, but they're very interconnected as one big community, even though we're spread as seafarers amongst the waterways. This slide comes from the Torres and Cape Hospital and Health District vaccination program. I personally want to commend, and us as a community want to commend Torres Strait and the Cape Hospital and Health Service for making their progress in each island community publicly available and updated since early days. I want to start with the very good news. There has been a remarkable increase in the coverage of first doses and gradually 2 doses over the last 1 month in the Torres Strait Islands. From somewhat concerning level of 73% and 58% in mid-November, we now see coverage of 87% and 70% respectively across the islands. It needs to be stated that after the first rounds of vaccine clinics, where very keen people came for their vaccines, it becomes much harder to bring those numbers up because sometimes it requires the mind change, overcoming fears and winning people over from believing false and dangerous information to listening to Torres Strait Islander health instead of listening to Torres Strait Islander health workers and nurses and doctors. Particularly gratifying is the rapid increase in coverage on Mabiog, Ngurupai, which is known as Horn Island, and Urab. Both communities have achieved significant jumps in just 1 week from a concerning 67, 66, and 61% to now 82, 87, and 81 for first doses in just a fortnight. With this level of invigorated community participation, we anticipate the double doses to rise as quickly as possible given the necessary interval. It's also encouraging to see increases in the communities close to the PNG border that may be challenged by international border crossings at any point in time. The TCHHS also deserves kudos for establishing a First Nations team to champion the voices of community in urging people to understand the real facts, as well as the urgency of getting vaccinated as quickly as possible, given inevitable introduction of COVID cases. This seems to be working well. Also helpful is the increased availability of vaccines. Vaccines were only available through the vaccine campaigns with mobile teams. Now it is possible to get a jab on Urab, Lama, Ngurupai, so all these small islands, very likely helping to drive success and being places where there may be close race between second jabs and COVID arriving. Testing is available on most islands across the Torres Strait and the MPA, which is the Northern Peninsula area. Recommendations for family on the Torres Strait Islanders: we encourage you to make vaccinations a first priority in your life, be it your first, second, or booster jab. First jab without a second jab or a long time after second jab means you may not be protected at all from the worst that COVID can bring to our community. I want to personally say well done so far, but the job is not yet done. Also remember, these numbers are only about our adults and not our children. We represent about 1/4 who represent 1/4 in our communities. As soon as the children's vaccine is fully approved and available in the Torres Strait, we urge families to protect your children as well as adults from this terrible virus. Now the frightening news. Just an hour's ferry ride south of the main inner islands, the Northern Peninsula area picture is significantly more worrying. As we can see here, as of 13th of December, with the notable exception of Sasia, vaccine rates 70% or below for 1 jab and as low as 40% in some communities. Healthcare professionals in the MPA region are extremely concerned. These communities are the final destination of many holiday makers up at the Cape York area, and an introduction of COVID-19 seems inevitable and probably in a rapid way. Substantial effort has been made in the MPA to get people vaccinated, but there are reports of widespread infiltration of American pseudo-religious anti-vax information in these communities. These dangerous messages has caused enormous stress, heartbreak, and extreme COVID risks and vulnerability to healthcare workforce, striving to protect these extremely remote communities from catastrophic impacts. Despite Queensland Health and Arapuna Cape York Health Council are taking firm steps to encourage vaccination in multiple ways, more than any else, they understand and feel the urgency of this situation. Travel once sick with COVID will be very difficult. Road transport up Cape York is long and very uncomfortable, even without COVID-19. And there are limited hospital beds and vehicles and evacuation helicopters to service both the Torres Strait and MPA. Doctors are doing what they can plan for a COVID outbreak of enormous impact. Recommendations for the families of the Northern Peninsula area. Please understand that the information flooding into your social media and about the dangers of vaccines are just wrong. They are not shared to help or care for you. They are shared because they want you to swing open your door to COVID and allow this virus to devastate you and your family. Listen to the people you know who can look up the facts and see what's happening. I finish this with the last message: get vaccinated today. Take your whole family, urge all the people you love, you live near, you share hopes with and dreams with. To the Northern Peninsula area, you can do it. Ki meso. Thank you.
Francis, a compelling message. Thank you so much for sharing that. I'm going to hand over also now to University of Sydney epidemiologist and Professor of Health and Wellbeing, Professor Melissa Haswell. She has a few words of wisdom to also share with us. Over to you, Mel.
Thank you very much, Lisa, and thank you, everyone. I don't have much to add because I think these discussions have been incredibly illuminating and really hitting the key points. I just might say one thing, and that is that we might think about COVID-19 as a health problem, but actually it's a problem across all aspects of our lives. So don't feel, just to urge anyone who gains knowledge from the doctors and the reliable information to have conversations. Don't be shy. If you know that your information is true and correct and coming from very reliable sources, please don't hesitate to share that round. Whoever you are in your community, everyone has a role to help other people protect themselves, their families, and your communities. That's all, Lisa.
Thank you very much, Mel. And again, wise words. So we've heard from three esteemed speakers. We've heard something of their experience in this. And one of the things that I would love to ask each of them, and I'll start with you, Michael, is we know that COVID's on the rise. It's unlikely to change anytime soon. And there is experience of people that we know that have become unwell with COVID. And we know the effect that has had on many in community and what that means. Can you share a little bit about your understanding of how COVID is affecting people in large urban environments such as the one that we live in?
Yeah, thanks, Lisa. Where do you start? So when people become unwell and you have to isolate, that's one thing. But then people can become incredibly unwell. Though where possible, people are kept at home. You don't go to the hospital. A hospital is a last resort. But you have to then work out, and New South Wales Health does help with all of this. But you have to work out care plans and those sorts of things of how people will be cared for at home. But with our families, I think it has a double impact. That if you've got like intergenerational households and the entire household then has to isolate, family sort of the impact on the family is tremendous. Look, what else can you say to that? It does affect every aspect, as Melissa was saying, of the entire life, of your life, and people can get long-term COVID as well. It's the other thing, so you can be sick for a very, very long time. So it's not sort of something like you get a cold or a flu and then you get better. It might not be like that for you. So vaccination really, really is the key, but also testing. And I think Francis mentioned this. If you've got the mildest of symptoms, please go and get tested. Testing, detection, those sorts of things. There's likely to be more COVID circulating than what we know because people are asymptomatic as well. But yeah, it's a bit of a worrying time, and I know everybody's really tired and want to go home, and a lot of them who live in Sydney want to get out of Sydney. I'm one of them.
Yeah.
But you might need to have a think about, can you hold off just a bit longer at this point?
Yeah, I think that's really important to note. As much as our mental health really depends on us seeing our families and those we miss from community, there is a time where I think we just have to take a deep breath and think about, if someone was sick in the household that we were visiting or staying in, what does that mean? And how does that create an additional impost upon them? Francis, I might ask you also pretty much the same question. You know, if someone gets crook in a household up your way, then what happens?
And this is the worrying thing, as I stated, in the vast landscape, Torres Strait is the minority group, but they're so interconnected. COVID to spread, you know, if I foresee what COVID would look like, it would be devastating. The culture governs the way we live and interact, and COVID infiltrating our culture means that it will just spread within communities. You know, these is everything we do within our communities actually exacerbates the outbreak of COVID if it was to hit, because we interact so closely, our culture, with everything from our ceremonies, our communities. Yeah, it's frightening to think of. And I think this is the message that we have to get across, that, you know, when we think of these big landscapes in the major cities and how it spreads so quickly, we've got to now multiply that by our ways of being as First Nations people and in interacting together as a tight-knit community. We really don't stand a chance unless we do get vaccinated. We do support our elderly, our vulnerable, by stepping up, getting tested. And we've got to make these measures so that our communities remain safe, that we don't have to put in, you know, these health services strains that are probably not going to be able to support the Torres Strait as a region.
Yeah, and that's tricky. And of course, there's a lot of lessons there, because you know, not everyone lives in a large urban environment, and they don't all live next door to big hospitals, and not all those big hospitals are going to be able to accept COVID patients. And all of those big hospitals are at the moment starting to feel the stress and strain, notwithstanding the staff that have been highly exercised over the last 18 months to 2 years. This has been a long-term battle, and it's not only the hospital staff, it's all the emergency services, it's all of our teachers, you know, like, just name everybody, and we've all been under the stress. I think there's about 9 messages I've gotten out of what you three have shared with us. And if it's okay with you, I'll try and summarise it, okay? And if I get something wrong or not quite right, I know you'll jump in at the end and correct me. So firstly, the whole idea of vaccination, as Pastor Ray Minnicon said, this is an act of love to get vaccinated, because it protects you. It protects those you love and care for, and others that you walk past in the street or go shopping with. You know, it's a way of helping bolster the entire community. And it's not just getting the first jab, but it's being timely with the second, and it's being timely with the third one if you're immunocompromised, or getting your booster at the right time and supporting others. But I suppose part of what you're saying without saying it is tell people why you got the jab. Let them know that you've had the jab and these are the reasons why. And that's one way of, I think, countering a lot of the misinformation that people are receiving at the moment. The second is to be brave and courageous and make decisions that keep yourself and each other safe, which I think is really solid. Our people are known for being incredibly brave and courageous, and now is definitely the time to continue with that norm. Support others and keep them safe, support the evidence, and know where to find the sensible advice, which of course is on your local Aboriginal and Torres Strait Islander community websites. It's on the Department of Health websites. There's a whole stack of jurisdictions that have got stuff for you. The third thing is about wearing masks. And I know a lot of people have made some deadly masks. They're absolutely fantastic, but the key with them is that you need to wash them regularly. And if you are in a household or if you are going into an environment where you believe sick people are, wear the disposable ones if you're able to get them, okay? And discard them by taking them off your ears and throwing them away straight away. Don't reuse them, okay? They're one-off wonders. And for your reusable ones, please wash them every day. That's really important. The next thing is about hand washing and keeping your hand hygiene standards up. Very, very tricky now that I'm seeing stores in the local area here pulling down their hand hygiene stations. So I marched into my local Woolies and demanded they put it back, and they looked at me as though I was from Mars or something. But no, I think it's important that we as citizens advocate for these things, because it just makes it a lot easier for people to be able to put the squirt on their hands and be safe when they're shopping, because I don't know about you, but I do look at packages when I go shopping, so I don't want to spread anything that I may have on my hands to others. Keep your jabs in accordance with the schedule, and we've talked a little bit about that. Michael was sharing, you know, if you do need to go home, if you can't not have people in your home, make sure you throw open those windows, try and do as much as you can outside. Ventilation is really the key. Keep the doors open if you possibly can. Try and avoid overcrowding, and that can be very hard this time of year, but really please do your best and put in all of those other things like, you know, hand washing stations and get people to wear masks. Know something of this thing, learn the story of it. There's a lot of websites that have got lots of information on it, including OzSAGE, which is where this video is coming to you courtesy from. Know that it's really effective. Know that although Omicron at this stage is seen by some as being less dangerous than Delta, I personally think it's probably a little bit more dangerous, because it's proven to be really agile. It's proven that it can learn, and there's a couple of different types of Omicron around now. And I have no doubt that it will change its nature again fairly soon and become one that will make people a lot sicker. So it's highly infective, it's highly aerosoled, it's really super duper agile, and for those reasons I'm concerned. We need to protect each other in our hospital system. We've already talked a little bit about the hospitals, and even though you may get sick, a lot of the hospitals will find it very difficult to look after you. And of course, I suppose, and this is my thing, is about focus on what you've got control over. People call that agency. So sometimes things feel like they're out of control, and they are a little bit, but there's a whole stack of stuff that you're in control of. And how you act over this next period of the pandemic is really going to be a testament to you, how you contribute to keeping others safe around you and keeping yourself safe. That doesn't mean you may not get sick, but it will certainly mean that others won't get sick as badly, or it won't spread as much because of your individual actions. So I'll just have a look at our guests and see if there's anything else that they'd like to say, and if they unmute, I'll be able to witness that. Melissa Haswell.
No, I just had one thing to say, and that is love your health workers, love your doctors, love those people who are standing out. They'll probably be standing out on Christmas Day, taking samples from, just to keep you safe. They're wonderful. They're our heroes, really.
Yeah, they are absolutely. Thank you very much for that timely reminder. We do have to remember our own patients, and I know everyone's frustrated at this time, so yes, that's timely. Well, everybody, that is all from us for this year. We really do want you to be safe. We really do want to see you next year, and we really do want everyone to come through this together. So thank you so much for your time. Again, OzSAGE.com, your local community-controlled health organisation, and of course, your jurisdictional health services have got all the information you could possibly need. Stay true, be well. Bye for now.